Discussion? Any further discussion?
No.
Hearing none, all in favor, please say aye.
Do you think this need to see it?
Opposed? Say nay. All right, motion carries. We have an approved agenda. Next item on the agenda, the approval of the minutes from our June 18th meeting. Hopefully everybody's had a chance to review those. Any comments, questions, or entertain a motion?
Motion to approve the minute. Second.
We have a motion and a second. Any further discussion on the minutes? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay.
I'm not opposed, but I'm going to abstain because I wasn't here at the last meeting and didn't hear very well when I was trying to listen. So I'm going to abstain.
Do we have a, was a motion passed? We have one. Okay. All right. Motion carries. Next item on the agenda, board president announcements. I have no announcements. Next item, health officer presentation and report. Item 25-26, discussion and vote, health officer's report. Dr. McLaury, we'll turn it over to you.
Thank you very much. You'll notice that this is the quarterly report, so you've got the April, May, and June figures. It's pretty straightforward, nothing earth shattering, just as a quick sort of reminder. We continue to do robust lead testing. In June, they did 426 lead tests with 15 stakeholders. The stakeholders are providers, daycares, early childhood programs, as well as private providers here in the community reporting into that. We have 3 maternal infant health dedicated CHWs. 2 of the 3 rotate through the 3 pregnancy crisis centers or locations. One is community-based, doing home visits. All 3 do provide insurance navigation services. And the MIH team, just as a reminder, hosts a weekly Tuesday evening maternal education class, empowering moms and babies through education and resilience. That's the EMBER program. And every other Tuesday night, they have a support program for pregnant and postpartum moms that has been very useful for building community with those moms, which is an important part of their journey as well. Our public health nurses have been busy with animal bites, childhood lead cases, reportable diseases. The list of reportable diseases, if you don't know, is a pretty extensive list: Lyme disease, that sort of thing. Many of the state programs for the Department of Health and at the state level have been also getting cutbacks, as we've seen statewide. So some of those reportable diseases that were followed at the state level are now being followed, transferred to the local level. So our public health nurses are also now doing some additional duties and following those up. They provide education to the clients, encourage follow-up care. They schedule vaccines when applicable. They also work with our community providers to understand the needs and to coordinate care. So if a community provider has a question about, hey, I've got a potential rabies case, what do I do? They can call and talk to the public health nurses and get some help. We had a bat in our refrigerator last week, so to be sent downstate. That was one of the other things we lost through cuts for the State Department of Health, was they're no longer providing courier service. So we're absorbing those costs for sending things downstate to appropriately. That costs extra money, just as an FYI for you, so that you're aware of the day-to-day operational things. Our school nurse liaison is communicating with schools, nurses by email and phone, providing information about school health issues, assisting with vaccine record translation, and when appropriate, refers the school to community partners who can provide hands-on assistance or provide additional assistance. Also, our school nurse liaison serves on some of the district's wellness committees, the school wellness committees, as well as advocating for school health resources in our community. As you know, we have an Amazon post where you can purchase, community members can purchase items for schools that, to try and keep kids in the classroom rather than sitting in the nurse's office or parents having to leave work to go to attend to the child's needs. We have our, again, our community health workers. They also are continuing to do social needs assessments, offer insurance, navigation, connect individuals to our resources and medical providers in the community. Those community health workers are based on the census tracts in St. Joseph County, where the highest social vulnerability needs are. They are doing health fairs and events. They're providing blood pressure screenings and hypertension education. They're looking at widening that program a little bit in terms of looking at chronic health issues going forward. We do have our mental health and substance abuse program, which aims to educate the community on addiction, substance use, mental health, and available resources in our community. Our mental health and substance abuse program coordinator participates in events to provide education, reduce the surrounding stigma associated with substance abuse, and provides naloxone within the community, as well as the naloxone boxes that you've heard about. TB program remains very busy. There's currently serving 133 people on new or latent or active TB, and also doing blood tests that are necessary. They had the IU medical students come through to get their blood drawn for their required TB testing before their clinicals. So we had a waiting room full of IU med students. They've been the immunization team, which provides immunizations to all residents of St. Joe County, whether they're insured or not. We have our in-house clinic here, and then our mobile unit. Our mobile unit travels into the community to increase access for especially like working parents having difficulty getting away from their job during work hours, to make sure that their children get the required school immunizations. We are also helping other community members, Dukem Center, Sisters of the Holy Cross, Goddard School, Stars Academy. Those are some of the examples of places we've been in the last month. The food and pool inspection team has been busy with investigations, follow-ups, and their related tasks. Certainly, you can think about all the summer fairs, food-oriented events, 4-H fairs, Fusion Fest will be coming up, Notre Dame football, and other events will be coming up. The Vector, this is a very busy time for the Vector team. We're down to one person in Vector, and so he's keeping pretty busy. He was doing a lot of testing and testing from trapping. He had 39 pools of mosquitoes that he split. And as you know, West Nile virus has now been found in this county. So that's expected this time of year. So I just wanted to give you an idea of things that we do routinely, but some of the changes that have been made as well. Do you have any questions about the report?
Any questions for Dr. McLeary?
A question on the financials. So it looks like a couple of the grants that we were spending down have been spent down.
Correct.
Is it, but you can tell me to be sure, is it the lead grant and the
Do you want to address that, Amy?
Can you repeat the question? I noticed, looking at the financials, that a couple of the grant, programs, buckets that we've been trying to spend down have been spent down. And I just wanted clarification on which ones are done.
Have been completely
Yes.
exhausted.
Yes.
The countywide lead initiative, that has been completely exhausted. That programming, as well as those staff members, have been offloaded to HFI, as well as the health safety pin grant. We are going to be coming to you later in the meeting to request to apply for their next grant cycle. However, the funds for the current grant cycle have been exhausted, so that programming as well as those staff members have been moved to HFI. So those are the two new ones for the month of June that have been exhausted.
Okay. Thank you.
Any other questions? Maybe while you're up, how's the budgeting process going in the
We had our budget meeting Monday with the council commissioners and auditors. They were very appreciative of the Department of Health and staying focused on the community, the health of the community, given our financial situation. The next step is to wait for the public hearing from the county council, which that'll happen in late October.
So I have another question. It has nothing to do with financing,
Okay.
sorry. But the radon test kits, do we still have a lot of those available or?
We do, and we're continuing to disseminate them. That was a new item that we added on to the report. I wanted to make sure that we included all the work that
Yes,
the
mhm.
team was doing. And so that's an incredible, valuable program, and we still do have test kits. They've been very good stewards of their resources, and they are pacing themselves.
Because I know they were distributed to some of the libraries in town, is that correct?
It's correct.
And
they
then here.
reload, yeah, and they
yeah.
reloaded the libraries too.
Oh, okay, very nice. And those are free,
Those are free.
okay. Very nice.
Any other questions for Dr. Migliori or staff?
Shout out to Amy helping us get through all of our budget. This round is everybody, the whole team. We've consolidated positions, people are stepping up, and I just really appreciate the work that the department has done. We appreciate the support of the council and the commissioners. You know, it's been, frustrating to be in the situation, but everybody has been very willing to roll up their sleeves and work. And we really, truly appreciate that.
Uh,
To hear.
Mhm.
Yes, yeah, thank you all.
Thank
Do you want to add anything to the West Nile Library? Can you just, I guess, for the record, tell us a little bit about what we do when we have this situation with West Nile?
Is Brett here?
This is Brett's baby.
I know.
All right, what kind of answer do you want? Do you want like from the public perspective, or like what do I do for West Nile?
From the public perspective, I guess, what are we doing as a department to help, contain or reduce their exposure to the chances of getting West Nile from a mosquito bite?
So from the county health department perspective, when we do detect West Nile virus, either in-house or within a very short time frame of getting it from the state, we will go out and spray via truck-mounted sprayer in a 3/4 to 1 mile radius around the trapping location. That way we can try and knock down the mosquito population that is in that area. As we go throughout the summer, we will try and, especially put preference towards sites that we're collecting lots of mosquitoes at that are also testing positive. But we're also trying to go out and do larviciding as well, finding known mosquito breeding sites and treating those, as well as trying to, find new ones that may be breeding and treating those. And then trying to get the public to be aware that they can also do things to help themselves as well. Draining bird baths, pools, cleaning out gutters, that sort of thing, just to try and reduce the overall mosquito population in the area.
Great. And then on the spraying schedule, that's on our website, right? You put that on there so people know what's going on?
Yep, before we go out and spray, we will post a public information sheet showing where we're planning on spraying and what product we're applying, kind of giving the bounding roads for where we're at, and try and make it easy, like, within like between, Darden and Cleveland, just try and give a nice concise geographic area for that. We'll post that between 3:30 and 4 o'clock, the day that we're going to go out and spray. There's also the option for those who are interested to sign up for text and or email alerts on our website. And if your property is within the area that we'd be spraying, we can send you a notification.
That's great. Thank you. Any other questions for Dr. McGlory or staff? Okay, hearing none, I'll entertain a motion to approve the health officer's report.
I motion to approve the health officer's report.
I will second.
Motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item, new business. We have no new business this month. The next item after that is grant requests. We have two. Item 2527, discussion and vote, applies safety PIN grant, protecting Indiana's newborns. Hopefully everybody saw that in their packet, and Renata maybe is on it.
Hello, Renata Williams, Director of the Care Unit, second floor law building. We are seeking approval to reapply for the safety pin grant. This is a grant that we currently have, as Amy said, that we've spent down. The first 2 years is awarded through application. The second 2 years is a performance-based award. So depending on the goals that you've set and the birth outcomes in a decrease in the IMR, IDOH will decide if you will be awarded for the second 2 years, and they will give you that sum at that time. So we are seeking to reapply for that grant to continue to support our relationship and partnership with Women's Care Center to cover the CHW that we currently have there. In addition to, we have expanded the program into a home visit, and we have another 2 CHWs, so in the home visit program. So that would be a total of 3 CHWs, and our MIH coordinator would be funded from this application, in addition to our program supplies. So any questions you may have, I'm happy to answer.
So a couple of questions. So this is a reapplication, so it's based on our performance, the department's performance the past couple of years?
No, so this
Or-
process is now starting all over. So those 4 years are done, and now the applications are now open. So if you want to apply for the first 2 years, will be awarded based on the application. So if we do get the award and we do perform accordingly, we can potentially receive another 2 years.
Okay, so that's why we're talking about a 2-year renewable grant, but the term of the grant is 4 years.
Yeah, potentially 4 years.
I
Mhm.
see. Okay. And then mostly just to kind of get it on the record, it says that we would support, the grant would support 4 employees, and those are current employees who are now on HFI funding, but this would allow us to hopefully put, have their salaries, et cetera, funded through the grant, so we have a little more breathing room with the budget.
Correct.
Okay. Great. Thank you.
You're welcome.
Thank you in advance for all the work that will go into applying.
Lots of meetings are happening right now.
Any other questions for Renata or Dr. McGlory on this item? If not, I'll entertain a motion.
I will move.
Second.
A motion and a second. All those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, the added item is to discussion and vote on applying for an automotive safety program grant for 8 car seats to serve the Ember program. Is that or the part of the
No.
Ember program?
That is correct. I wasn't sure if this one was gonna go next or the other grant application on here. I mean, the other agenda item. So I'm glad I stayed up here. So yes, this application, we just received information via email yesterday. So I apologize for the late addition to the agenda, but this is an opportunity. We had a couple staff recently receive certifications in the child passenger safety course, and they emailed all of those technicians to let them know that this opportunity is available. And it is to provide some community car seat clinic funding. So we also already have a structure within Ember where we have a class that we provide the education to the moms about car seats, and we offer car seat checks. So this is going to be an opportunity to expand and provide an incentive for those who maybe have children that are outside of the weight limit, and we could provide a car seat and also raffle off some car seats during that class.
Now that you're aware of this grant, do you have a sense of whether there might be more opportunities in the future to apply and get more car seats, or is it?
No, because we just learned of this yesterday, and I was reading up on it as much as I could. In the application, you have to fill out so much and then tab and fill out so much and tab. So I do not know, to be honest with you. I hope so.
Yeah.
So.
Be great. Any further questions?
Yeah, so this is not monetary, this is actual car seats that we would.
Correct. And the organization is going to managing all of the ordering and the shipping and make sure we have it if we are awarded
Yes.
in time for the event that we have, which is our class, which will be a part of our class, and ship it to us. And then we have to upload information to their portal about who we gave it to and, and such, but yeah.
Great.
Are they for a variety of different sized children, or?
Yes, so that was an option as I was trying to sneak through the application and look to see what was all of the questions. So they have some infant car seats, some convertible car seats, but there's a maximum, a total of 8, but only a maximum number that you can receive in each type of car seat. Yeah.
Great,
So just a little extra incentive for our class.
nice.
Thank you. Any further questions? Hearing none, I'll entertain a motion.
I will so move to apply for the grant.
Second.
Motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
I
Opposed, say nay. Motion carries. Next item on the agenda, old business. We have no old businesses this month. Item after that is public comment. If you'd like to speak in the public comment section, please sign up on the sheet over by the door. Jenny, do we have anybody signed up? We don't. Okay. Next item on the agenda is the time and place of our next regular meeting. It'll be August 20th, 4:30, right here in the 4th floor council chambers.
Where you vote on that.
Okay,
Want to publicly apologize for my lateness. To board members, Mr. Levin, Dr. Miglioria, and staff, everybody here, members of the audience, babysitting for 2 of my grandchildren under 2, and completely overwhelmed me, blew by my time frame. Had everything marked, ready to go, but I just didn't make it. So apologize for that. I'll do better to get them better organized next time. So apologize for that. Thank you.
good luck with that. Right, I don't think we need a motion on the next time and place of the meeting. That's when it will be. Last item is adjournment, so we are adjourned.
Thank you.
Thank
Thank you
you.
all. And